We are mHealth Fairview, and this video shows a malignant hyperthermia drill. This is a condensed version of how a malignant hyperthermia event would occur. This video does not involve a real patient. Malignant hyperthermia, or MH, is a rare but life-threatening condition related to exposure to certain general anesthesia triggering agents. This event can eventually lead to circulatory collapse and subsequent death if left untreated. Due to the rarity of this life-threatening event, Joint Commission requires we either view or be part of an MH drill annually. There are many roles that will be shown or talked about in this video. Roles may change depending on your location and the number of staff that are available to help. Some areas in the United States with high MH incidence include Wisconsin, Nebraska, West Virginia, and Michigan.
All right, good morning, Dan.
Good morning, Dr. Kevin.
All right, good morning. We're going to get you off to sleep here.
Our mock patient is put under general anesthesia. Possible anesthesia trigger agents for MH would be a volatile inhalation agent such as sevoflurane or the depolarizing muscle relaxant succinylcholine. Some signs and symptoms for MH is unexplained tachycardia, acidosis, which includes increased end-tidal CO2, muscle rigidity, skin mottling, and a high fever.
All right, my patient feels a little tight. Can I get some more muscle relaxant?
Yeah, I got some here for you. All right. She's getting a little tacky here. Just a sec. Yeah, my end tidal is way up. I can see this temp starting to climb too. I wonder if she's got a malignant hyperthermia.
Yeah.
I think let's call it MH.
Yeah. Can we call a code, please?
Yep. Malignant hyperthermia code to OR19. Malignant hyperthermia code.
Can I get a big sponge, please? Covering the wound.
All right, I'm going to stop my sevoflurane.
Let's get these drapes off.
I'm going to start a Tiva.
Right, so, were you seeing rigidity?
Yes.
Okay, the tachycardic, the temperature's up, and boy, their end-tidal CO2 has gone way up. Yes, we have MH. Let's go ahead and get the MH carts in the room.
When a malignant hyperthermia event is identified, you want to stop the triggering agent, call a code malignant hyperthermia, grab your MH cart with the Ryanodex, call the MHOS hotline, hyperventilate with 100% O2, start cooling measures, obtain blood gases and other labs and treat accordingly, and treat dysrhythmias accordingly. Make sure you know the location of your MH cart and familiarize yourself with its contents. There should be an MH poster in your department. This is a great reference.
Anesthesia aid, what can I do to help?
Can you get some ice, a couple big little pink buckets of ice, and
Yes.
bring it back here
Yes.
right away, please?
Right there.
All right.
Here's your
thank you.
filters. I'm gonna get the Ryanodex up and running.
You don't have to tear them apart.
Okay.
Pop it out of the paper.
Pop it out of the paper.
Put one.
Down.
And then once you-
What else do you need?
Hi, can you bring me the Dantrolene or Ryanodex? We need some additional of that.
Okay.
All right, thank you.
Have ice.
All right.
And here's your Foley
But
tray.
I'm also going to switch out
All
my
right, folks,
Here's your Foley tray.
We'll put that down on the.
increasing flows and switch up my absorbent.
Behind the mess.
We're not gonna lift the head,
Okay.
we'll just go with what we got for the moment. Maybe on the abdomen if there's a spot, but we're good here.
Here's your first dose of Ryanodex.
Okay. Hi, good morning, Chris. You're from mHouse, correct?
Yes.
Hi, good morning. Kevin Cardinal. I'm an anesthesiologist from Fairview Hospital in Minnesota. We believe we had a malignant hyperthermia event occur this morning, and I want to run this by you. So we have a 42-year-old female. She was in our operating room this morning for an exploratory laparotomy. When we look back at the history and physical, there were no significant medical or surgical histories that revealed the possibility of malignant hyperthermia. Just shortly after induction, it was noted that she became tachycardic. Her temperature climbed briskly. She continues to be febrile. We had a very large increase in our end-tidal CO2. Hypertensive blood pressures were recorded, and the rigidity of muscles in the extremities was noted. Just to let you know, we did use succinylcholine as an induction agent, and the sevoflurane was being used as the inhalational anesthetic. I'll let you know that we did give 175 milligrams of Ryanodex. First question I have for you is, when can I repeat the Ryanodex?
You can repeat the Ryanodex every 3 to 5 minutes.
Okay, as long as symptoms are present?
Correct.
Okay. We've gotten some ice packs in the room and have them placed. Are there any other cooling options that you would like to suggest?
The most effective way that we can try and cool this patient is by cold IV fluids. But keep in mind, we will be needing to monitor their temp by Swan-Ganz or an esophageal probe. You also have an option of bladder or rectum or an NG tube to help cool, but again, you need to be monitoring the temps appropriately.
Okay, so esophageal is the best choice for us.
It is.
All right, and as far as labs, we've done an ABG, we drew electrolytes, and we have coags. Any other recommendations of chemistries or laboratories that we should collect and have processed?
Yes, I would check a CK, a urine, and a myoglobin, and then you'll need to be checking these for at least 8 to 24 hours.
So confirm that with you, it's a CK and a urine myoglobin.
Correct.
Okay, great. And we'll check those on a scheduled basis based on patient status for at least 24 hours. Is there anything else we should do before we discharge this patient?
Yes, I would make sure to talk with the patient and family to follow up with some MH testing. They are going to need a muscle biopsy to confirm MH.
Okay, I appreciate your time today. If I have any further questions or need any additional advice, I'll give you a call back.
Thank you.
All right, goodbye. All right, Dan, so I've given the first dose already to index. Looks like they're still tachycardic and the end-tidal CO2 is still up. We'll wait 5 minutes. If not, we'll repeat it.
Okay.
In the meantime, let's go ahead and get a second peripheral IV and call the anesthesia techs. Have them bring a setup, and I'll get an ultrasound and we'll get an A-line in this first.
Okay. Piece of cake.
The other thing is, we're gonna get some labs.
Okay.
So I'm gonna make sure we send a CK. I know we put a Foley in. Let's get a specimen off there for urine myoglobin. And so I'll put orders in. You'll be able to print labels.
Okay.
Yeah, can we get some peritoneal lavage? Hold saline, please.
Hi.
Kevin Carter from Anesthesia. Hey, so this is Joyce Lampert. She is a 58-year-old woman who came to us for a exploratory laparotomy. She has a history of Crohn's disease. She's allergic to sulfa drugs. We did a normal rapid sequence induction because we were concerned about the possibility of reflux with her bowel pain. We noticed an increase in her heart rate, an increase in her end-tidal CO2. The surgeons reported rigidity. And the temperature also went shooting up. I saw it as high as 105. And so at this point, we have treated her with Ryanodex. We gave a dose of sodium bicarb, and we are going to transfer her to the ICU to your team. Please, I don't know how familiar you are, but no calcium channel blockers, please. I know that sometimes people want to control heart rate, but we're not going to use that for that. Other things to know is that we did send off a baseline CK, and we sent, I got my notes here, a urine myoglobin. Those need to be repeated up to 36 hours.
Okay.
The biggest concerns we have are acid-base imbalance.
Okay.
We're also concerned about arrhythmias. What we saw was a narrow complex tachycardia, but arrhythmias are possible in this case, and then monitor her renal function.
Sounds good.
Okay?
Yep. We'll keep her for at least
Great.
12 hours.
And then at some point, when you meet the family, you want to discuss with them. They're from Wisconsin.
Sure.
I met her preoperatively. We talked about That's one of those areas of the country where there's a higher incidence, so maybe the family needs to have some conference with
Testing.
their local physicians to see if testing is necessary for the family.
Sounds good, yeah.
Okay.
Thank you.
Any questions?
What was the last temp that you got?
The last temp right now is still 100.3.
Okay, sounds good. Thank you.
All right.
Please be aware of the System Malignant Hyperthermia SharePoint site for resources that will assist you in the event of an actual MH case. Resources include a dose calculator for Ryanodex and dantrolene, roles and responsibilities during a crisis, direct access to the MHOS hotline, and treatment resources. From the Perioperative Services Practice and Education, we thank you for viewing this Malignant Hyperthermia mock drill video.